Today I'm going to inform you about delirium. I will discuss the history of delirium, I will discuss the cost of delirium, the treatments of delirium, the symptoms of the disorder, and the history of it. Most of us cannot imagine how scary it could be to hallucinate or to forget where you are, but many people that have had this disorder can tell you some very terrifying stories of whenever they developed delirium. In researching, I learned how scary delirium can be for the patients and how one can get the disorder. Today, I will introduce to you the history, the symptoms, the cost, and the treatment of delirium. To begin with, I will discuss the history of delirium. The history of delirium was extremely confusing. I think mainly that the reason why it was so confusing is because when you look at the history of delirium, there is so many different other names that carry with what delirium is. In the 1st century, Celsus used Phoenitrus to describe delirium. Hippocrates also used Phoenitrus in 500 BC, but he also used 16 other different names to describe what delirium was in his time. The clinical meaning of delirium has always remained consistent throughout history. So, what delirium is and the description of delirium has always remained there. It's just the word that describes it has changed. The history is a confusing mess, but important to understand, just like knowing the symptoms of the disorder. To begin with, the disorder appears within a couple of hours to a few days, with it appearing within a couple of hours or a few days is what sets it apart from other disorders, other psychiatric disorders. Like, delirium is a lot like dementia or maybe schizophrenia where you hallucinate. I think that's the one that you hallucinated. The reason why delirium is so different than those is because those are onset, they're, developing throughout the days. But delirium, it comes in fast. The DSM-5 mentions 3 other symptoms of this disorder. Number 1 is a sudden change in a person's attention or awareness. Number 2 is an additional disturbance in cognition, like memory, disorientation, language, visual, perception. The last symptom mentioned in the DSM-5 is the disturbance in the mentioned criteria are not better explained by another disorder, like, a pre-existing disorder. A pre-existing disorder could be schizophrenia or dementia. Now that we have looked at the history and the symptoms of the disorder, let's take a peek into what the cost of it is. A patient who develops delirium have to stay in a hospital longer, which can be a cost. While in the hospital, the patient can develop pneumonia or, pressure ulcers, which results in a longer stay. A longer stay means more money. That's going to be cost for treatment and for the hospital stay. That's coming out of the patient's pocket, so that's a cost for them. A cost for the patient can be social strain. The patient is only seeing doctors and nurses, and they're not really seeing as many friends and family as what they normally may be, so they might be experiencing some social strain. The patient's family can experience things like, loss, maybe a feeling of loss, having to leave the patient there while they go home, and worrying, that's a cost. Finally, we will look at how one is treated that has delirium. The treatment it's kind of self-explanatory, but it's kind of a really long process because they have to do extreme labs and blood work in order to get to find out what is the underlying cause of delirium, because you got to treat the underlying cause before you could treat the delirium. To start with, physicians need to screen for delirium. They use a tool called the MMSE. It stands for Fallstein Mini Mental State Examination. And they use this throughout the course of delirium because it can detect whether or not the symptoms are improving or if they are getting more worse. And like I said, next they have to find out what the underlying problem is, and they have to figure out the underlying problem in order to treat the symptoms of delirium. While the physician is trying to find the underlying problem, they will treat the patient from their hallucinations and with antipsychotic drugs. The last things physicians will do is control the environment the patient is in. This is extremely important because a lot of times the environment is what can be causing the symptoms of delirium. So a lot of times the patient will be moved up by the nursing station so that they can be more closely monitored. Family and friends are encouraged to get involved because the patient needs constant reminder of what day it is and what time it is and why they're in the hospital. So family and friends get involved is better for the patient. And another thing that they have to do is control noise. Noise can make the patient freak out even more or hallucinate even more. As we have seen, delirium is a treatable but yet scary disorder to have to endure. That is the conclusion of this report. Thank you.